Welcome to the Bronchiectasis and NTM 360 podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchiectasis and NTM360.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not a substitute for medical advice. Please consult with your medical provider if you have any questions. Thank you for joining the Bronchiectasis and NTM 360 podcast. Today we have Medical Director of Bronchiectasis and NTM 360, Dr. Asksamit. As always, Dr. Asksamit, we are extremely excited to have you on this show. It is such a privilege for you to join us. Today, I would like to focus on treatment, and in this episode, we will explore various treatment options and discuss why treatment is not one-size-fits-all approach, as well as highlight the importance of airway clearance, medications, and the exciting developments on the horizon. This episode is filled with valuable information, so we've divided our discussion into two segments. So stay tuned for part 2. Dr. Asksamit, let's just start with a brief overview by explaining what bronchiectasis is and how it affects the lungs.
It's great to be with you today, Alyssa, and I welcome all our listeners, patients, caregivers, and other stakeholders in this area. This is a very exciting time in bronchiectasis with lots of information and research being done to really advance the science and I think benefit our patients and their families greatly. As we get on the same page, what I would share is that bronchiectasis in adults is a irreversible or permanent dilation of the bronchial tubes. We think that there's an initial infection or injury that causes that damage. And as a result, there becomes a consistent pattern of infection, of inflammation, a response to the infection, and abnormal mucociliary clearance or the inefficiency of clearing mucus against the backdrop of structural lung disease, which involves that dilation of the bronchial tubes. So when we think about bronchiectasis, we think about each one of those components: infection, inflammation, mucociliary clearance against the backdrop of structural lung disease.
Thank you for that recap, Dr. Asksamit. And for those of you who are interested in learning more about the vicious cycle, we do have an episode titled Introduction to Bronchiectasis and the Vicious Cycle, which provides an in-depth exploration of the evolution of bronchiectasis in the lungs. Finding the root cause of bronchiectasis is very important, so your provider will suggest tests based off of your symptoms. I always like to suggest that people write down their symptoms. That way they can find trends and patterns and then bring that information to their provider's visit to make sure that they're not missing anything. Another recommendation is bring a family member because they might notice things that you don't recognize in yourself because it happens gradually. So once diagnosed with bronchiectasis, you hopefully have some answers to what the root cause is. But as we've discussed in previous episodes, remember that 40% of cases are unknown. So it's possible that you won't find out what the root cause is. But anyways, as you have this diagnosis, is there any standard treatment that you would recommend, Dr. Asksamit? Is there any sort of recommendation based off of specific symptoms?
And this is another great question in the sense that, is there a one best treatment approach to bronchiectasis? And what I often share with patients is that the best approach is the approach that works for an individual patient and can be done, tolerated, and effective. Point is that one size doesn't fit all, and what works for one patient may or may not work for another patient, and what works for the other patient may not work for them. So it has to be a trial and error basis, and then it has to be applied on an individual basis to see what works for you. and there's not a right or a wrong. When I think about treatment, I think about each one of those components of the vicious cycle or the vicious vortex to help us understand how best to treat.
Yes, there are many different versions of treatment depending on the person's condition, capabilities, and the time frame in which they have to complete these techniques. Moving mucus can look different depending on a lot of different factors of an individual. Airway clearance techniques are common ways to facilitate mobilizing mucus, so getting the mucus up and out of the lungs. Airway clearance techniques can include physical devices, breathing techniques, coughing techniques. To give you an example, a physical device, also known as a positive expiratory pressure device or PEP device, these devices are going to help to keep pressure in the airway during exhalation. So when you exhale your air, it's going to assist in keeping the airways open and it's going to aid in moving the mucus up and out of the lungs. So, some examples of device would be a flutter device, an acapella, a flute valve, an aerobica. Again, those are examples of a PEP device. Another device that people will be prescribed is something called an incentive spirometer. So, with this device, it encourages a person to take slow, deep breaths in. It helps to expand the lungs, especially in the bases, and it's going to help to mobilize the mucus by keeping the airways open. I used to joke and say that everybody got one of these at some point in their life because they're given for so many different reasons. And in fact, a funny story is I found one for sale for $3 at a yard sale. So definitely do not recommend buying one from a yard sale. But overall, these types of devices are going to be pretty mobile, meaning you can pick them up, take them with you, and do them anywhere that you need to. As Dr. Asksamit mentioned, treatment is tailored specifically to you. So you might find that one thing works versus another. So it's all kind of trial and error, but making sure that you have that open communication with your provider because it might be needed later on that you escalate up to some chest physiotherapy, also known as high frequency chest wall oscillating device. Most of us will know this as a vest system. So a vest goes on just like a vest and it creates a vibration from the outside and it creates this tapping on the chest to loosen mucus from the airways, allowing it to wiggle its way up to the larger airways so you can cough it up more effectively. So, Dr. Asksamit, why is airway clearance a necessary treatment for bronchiectasis?
Treat just as you mentioned with airway clearance. So if we look at the abnormal mucociliary clearance, that is the inefficiency of clearing mucus, we want, if there's mucus sitting in the airway, we think it's a great place pooling for the germs that normally reside in our airway to grow, to cause more damage, more dilation, more retention, and set up that cycle. So if there is sputum present, we want patients to cough that out. And we think that the best and most effective way to do that is with airway clearance. I think about airway clearance as a spectrum of possibilities. And again, what works for one patient may or may not work for other patients. I generally start out with patients trying to be active. I hesitate to use exercise. We're not training for the Olympics in this way, but to keep moving and being active, not only is it a great wellness issue and from a overall health standpoint for bone health, cardiovascular balance, strength, stress management, it's a great way to mobilize mucus. Most of my patients walk, some ride a bike, some swim, some do yoga, some do Tai Chi, but the point is that patients remain active, and that's a great starting point for virtually every patient with bronchiectasis.
One thing that I'll add real quick is that if you are looking to get started with exercise, visit Bronchiectasis and NTM 360.org. And under the Learn More tab, you'll find tips on how to start exercising, things to consider before starting, symptoms that indicate stopping or when you should avoid exercising for a specific day, and so much more. So that way you can help get started safely. It is important to keep communicating with your provider if you notice that there's a deviation in your exercise or if you have some sort of exercise intolerance. What kind of medication might one see with treatment?
Next is then a way to increase the efficiency of mucus clearance with airway clearance using oftentimes what we call mucolytics or uh, medicines or techniques to thin the mucus. Most commonly, we use hypertonic saline, that is concentrated salt solution by a nebulizer, usually in the form of 3% or 7%, with the body's concentration being at 0.9%. And the idea here is to nebulize this concentrated salt solution, brings moisture into the airways, and allows patients to more easily cough out mucus if it's there. That oftentimes is done once or twice a day. There are other ways to thin mucus that are not FDA approved with limited success and generally not used widely. Sometimes individuals will hear about N-acetylcysteine or mannitol, which have been tried in the past, but with little data to support its regular use. Once we have patients active using a nebulized hypertonic saline, that's usually followed by a breathing technique with deep breathing with a huff cough, as you mentioned, Alyssa, to try to force air out from the peripheral airways and push that mucus back up. There are other techniques called autogenic drainage or active cycle breathing. And those are kinds of things that I would encourage all of you to talk to your provider, talk to your respiratory therapist or other resources that you have access to. And in fact, Alyssa will leave you with some great resources to see what those options are for you in this way. So there's a spectrum. Is there a one size fits all? Again, no. And we have to find what works best for patients. So we generally start out with being active, some nebulized hypertonic saline, some deep breathing with a huff cough or active cycle breathing with or without a Arabica valve or a flutter valve. And then in some instances to also think about a best use to at least on a trial basis to see if that helps mobilize mucus if that's one of our issues.
So it sounds like a treatment plan is really just based off of what, obviously, what the patient is going through, but how they can fit it into their daily lives. So it's really important that they're able to figure out trial and error, figure out what they can fit into their daily lives, what they can be consistent with. And what would you say to somebody if they feel like they don't really have any mucus? So maybe they feel like they have a dry cough or unproductive cough. Would you still recommend that they use those different airway clearance techniques?
And that's another great point that in some instances, patients don't have a lot of mucus, in which case the concern is all that mucus still pooling and I'm just not getting it out? And if there was a lack of clearance of mucus that was building up in the lungs, patients would have symptoms. And you'll notice that it's not going to be an issue whether there is mucus. And sometimes if there's not mucus or what we call dry bronchiectasis, then to stay active is important, but maybe we don't have to be quite as intense with the airway clearance. And likewise, it's important to realize that that intensity can escalate up or de-escalate down depending on what the clinical circumstances are. So, for example, when patients go into the hospital, we'll do this intensive airway clearance 4 or 6 times a day. But that's not a possibility as an outpatient. Otherwise, there's really nothing else that you do all day long. And so most patients will do that once or twice a day and either escalate up or de-escalate down, depending on what their clinical circumstances are. This leads perfectly into telling you guys about a newly designed tool called the Bronchiectasis Action Plan. So we're always working with teams of providers and patients, and we recognize that there was a gap in understanding what actions to take on a good day versus when it is necessary to escalate care and take action. This tool was overall designed so that way it could improve communication. It includes questions that allow for easy review of current treatment routines and regimens. It helps to identify what works well and what doesn't. And there's even a section that assesses what your goals are to help have good communication and help you to get the most out of your appointment. There's also a QR code that you can scan with your phones, and this is a symptom tracker.
So symptoms can happen gradually, making it harder to identify that there needs to be an intervention. So, by using the symptom tracker, it can help you realize if there is a deviation in activity, if there's a progression of symptoms, and there's even a place that you can track to see how you overall feel that day. Everyone's disease is going to look a little bit different. Everybody's treatment is going to look different. So it's really important to take this with you to your provider's office and work this out with them. Keep them in the know. So that way you guys can create a plan. You can be confident in the plan and feel secure that you are doing the right thing when you're supposed to, and get provider attention if you need it. So to access this, you go to Bronchiectasis and NTM 360.org. You want to click on the Learn More tab, and then it's going to be in the Downloads library. Everything is in alphabetical order, so you'll be able to find it under Bronchiectasis Action Plan, or if you're looking for the symptom tracker on its own, or if you want to just print that out with it, you go ahead and click on Symptom Tracker and Accountability Tool. Thank you so much for joining us today, Dr. Asksamit, and we look forward to continuing this conversation to discuss what treatment might look like if you have overlapping COPD and asthma or asthma, when antibiotics might be needed, and the role and importance of a sputum sample. We will also look at the importance of treating underlying conditions to help with the symptoms of bronchiectasis. Thank you for joining us.
It's been great to be able to be with you today, Alyssa, and the rest of our listeners. And I would just concur in that there's great hope on the horizon during this time of bronchiectasis and investigations, and wish you all a very successful implementation of treatment.
Thank you for tuning in to the Bronchiectasis and NTM 360 podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insight, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.